Hi, good afternoon, everyone. Thanks for joining us today. I'm Bronte Forsgren. I'm analyst for the evidence-based policy team at Arnold Ventures. Today, I'll be joined by my colleagues, Dave Anderson and Aaron Crossett, to discuss our team's request for proposals for funding randomized controlled trials, or RCTs. We're excited to see so many people sign up today, including new names and faces, and look forward to working with you in future grant applications. As mentioned in our registration, we have two key goals for our webinar today. These are to expand and diversify our applicant pool and to clearly convey what our researchers look for in grant proposals. As a first step towards our goal, we've increased our outreach efforts to spread the knowledge of our RFP farther and invite you all to share the information you learned today with friends and colleagues. Within the next few days, a recording of our webinar will be sent out to attendees and will be publicly available, and we invite you to share. So our roadmap today will be as follows. Dave Anderson, our Vice President of Evidence-Based Policy, will be discussing why Arnold Ventures and our team in particular are committed to funding RCTs, and will provide an overview of our RFP and application processes. Aaron Crossett, EBP Team Manager, will discuss tips for submitting a successful proposal, including common missteps to avoid. Afterwards, we should have plenty of time for a question and answer session. So before I turn the time over to Dave, I want to share a quick logistics pointer. Some of you have already submitted questions in advance, but if anyone has additional questions for our panelists, please submit them using the Q&A button, which should just be 2 from the right on the button panel on the bottom of your screen, rather than the chat box, and leave the chat box for any technical difficulties or issues that are coming up. With it being in the Q&A, it ensures we can see your question. So with that, let's get started, and I'll turn the time over to Dave.
Okay, great. Thanks, Bronte. And thanks everyone for joining today. We're definitely excited to see so many folks here and a lot of, like Bronte said, new names and faces. So I'll dive right in and talk a little bit about sort of where our organization comes from and sort of our priorities and our thinking behind this RFP. And then I'll dive into some of the specifics about the criteria we look at when we're assessing applications to the RFP, and talk a little bit about the application process. So to get started, Arnold Ventures' core mission is to invest in evidence-based solutions that maximize opportunity and minimize injustice. Across the organization, we have a particular focus in a few different policy areas, including criminal justice, healthcare, higher education, and public finance. But that said, we're always looking at other areas that might someday become focus areas for our funding. And as I'll discuss in a moment, our team at Arnold, the evidence-based policy team, funds rigorous evaluations across all areas of social policy, so not limited to the specific areas that we have teams focused on here. And other teams at Arnold will frequently issue RFPs, which can always be found on the RFP page on the Arnold Ventures website at arnoldventures.org/grantees. And through those RFPs and discrete research grants, other teams at Arnold fund not just randomized controlled trials, but other important types of research, like descriptive studies and non-experimental studies to look at important research questions. But today, we're going to be focusing on the RFP for randomized controlled trials that our team oversees. So before I go too much further, I know we have people on the webinar today from many different professional backgrounds and levels of experience. So just as some level setting, I want to make sure we're on the same page about what we mean by a randomized controlled trial. So a randomized controlled trial, very briefly, is a study where individuals, or sometimes clusters of individuals, like schools or communities, are randomly assigned to either a treatment group that receives a program or to a control group that doesn't receive it. And what makes randomized controlled trials uniquely strong in terms of their ability to measure program impact is that process of random assignment ensures to a high degree of confidence that there are no differences between the treatment and control groups on observable or unobservable characteristics, except for one. The treatment group receives the program being evaluated, and the control group does not. So as a result, if you track outcomes over time, you can confidently attribute any differences in outcomes to the program being evaluated and not to other factors. So that's what we're talking about when it comes to randomized controlled trial. And now I want to get into sort of a guiding principle behind our work. And that is that, and sort of our view of evidence-based policy generally, and that is that we know from the history of rigorous program evaluations, particularly randomized controlled trials, that surprisingly few social programs and interventions succeed in producing meaningful impacts on the outcomes that they're seeking to improve, whether that's in education, poverty reduction, crime prevention, or other areas. And I say surprisingly few, but really it shouldn't actually be that surprising. These These problems that we're trying to tackle are truly challenging ones. And so it probably makes sense that a lot of things we try are not going to move the needle on the outcomes we're trying to change. Now, on the other hand, the good news is that we also know from the history of rigorous evaluations that exceptional social programs do exist. Programs shown in well-conducted randomized controlled trials to produce important improvements in people's lives. Big increases in earnings, increases in educational attainment, reductions in criminal behavior or substance use. And we believe that the key missing piece in many areas of social policy is that there are currently too few programs and interventions that are backed by sufficiently strong evidence for policymakers or practitioners to have confidence that if they were to adopt and faithfully implement them, they would produce meaningful impacts on people's lives. So our goal in funding randomized controlled trials is to build the body of proven effective programs so that policymakers and communities and practitioners have a bigger menu of options to choose from. And I just want to pause here really quickly before I get into the next part of my presentation to do a quick clarification on terminology. Aaron and I today may switch back and forth today between saying program or intervention. But in either case, when we're talking about using those concepts, we're talking in sort of general terms, referring to any kind of program or policy or practice that might be tested in a randomized trial. All right, so let me get into, I'll give you a brief sense of the numbers behind our funding. So since joining Arnold in 2015, we've funded over 90 randomized controlled trials for a total of approximately $52 million in funding. I won't make you do the math in your head. That works out to an average grant of approximately $560,000. But I should mention that approximately 2/3 of the grants that we funded are under $500,000. And our board has given us, our team, more latitude in approving grants under that amount. As you can see on the slide, we do and have funded more expensive studies, but they tend to be the exception, with only about 15% of our RCT grants being for over $1 million. And Aaron will be talking a bit more in the next section about how we think about study costs and under what circumstances we tend to make larger awards. So I'll leave that to her to discuss. And with that, I will jump into some of the specifics on the RFP. So within our team, we refer to this RFP as RCT Opportunity. It's sort of a nickname to shorten what's kind of an unwieldy official name of the RFP, which is Randomized Controlled Trials to Evaluate Social Programs whose delivery will be funded by government or other entities. And I want to sort of highlight that name because I think it reflects our board's preference for their funding to go towards the cost of conducting the randomized trial, so the research costs, as opposed to covering program delivery costs. Now that said, the board will sometimes agree to fund a portion of program delivery costs if the program that's being evaluated is backed by particularly promising evidence, and if their investment in program delivery is really necessary for the RCT to go forward. But even in those cases, generally the bulk of the grant should be going towards research costs as opposed to program delivery. So, before we fund a study, we want to make sure that all of the partners for a study are on board, including, other funders of program delivery, but also folks that, people who would be providing data that would be used to measure outcomes. And so we want to have all of those partnerships in place before we fund the study, but as I'll discuss in a moment, we don't necessarily expect all of those commitments to be in place at the start of the funding application process. We just expect them to be sort of nailed down in advance of a grant award. Now, besides making sure that the necessary parties are committed to the study's implementation, we apply 3 main criteria when assessing letters of interest and full proposals that come in through the RFP. First, we apply what we refer to as our importance criterion. So specifically, is the proposed study looking to evaluate something of policy importance? And we define importance in 2 main ways. The first is, is the proposed study looking to evaluate a program that's backed by highly promising prior evidence, suggesting that it could produce sizable impacts on outcomes of recognized policy importance. And these are outcomes like, educational achievement, workforce earnings, criminal arrests, hospitalizations. Basically, think about it in terms of outcomes that any policymaker or your average, intelligent newspaper reader would recognize as important. That's what we're looking to study. And we specifically encourage applications seeking to replicate findings from prior rigorous evaluations, that are especially promising, but may not yet be conclusive. And they might not be conclusive because, the previous study had just a short-term follow-up, or maybe it was a small sample or done in a single site. Or maybe the previous study was a well-matched comparison group study or a somewhat flawed randomized trial that leaves open some questions about what the program's true impact is. So the reason that we put such a premium on promising prior evidence is that, as I mentioned earlier, most interventions are found to have weak or no effects when ultimately evaluated in a sizable randomized trial. So by following signals from prior evidence, we hope to maximize our chances of identifying programs that are truly capable of improving people's lives in a meaningful way. So that's the first way that we think about importance, is prior evidence. The other way that we look at this criteria is widespread use. So is the program that's being evaluated already or soon to be in widespread use? And so this is a case where even if we don't have any prior evidence about whether the program works, because a lot of taxpayer investment is going towards the program, or because a lot of people are being affected by it, there's a clear sort of case or reason to do an evaluation to make sure that what we're doing is actually effective and achieving the goals that we're trying to achieve. Okay, so the next criterion after importance that we look at is we evaluate is whether this applicant's study team includes at least one researcher in a key substantive role who's previously carried out a well-conducted randomized trial before. And the reason that we use this criterion is that we've seen from our monitoring of the research literature that there are many ways that an RCT can go wrong. And it takes a special set of skills, both research skills and interpersonal skills, to pull off one of these studies successfully. And so our view is that the best predictor of whether a proposed research team will be able to successfully carry out a proposed randomized trial is that there's someone on the research team in a meaningful role that's previously pulled one off in the past. So to gauge whether the team meets this criterion, we ask that applicants submit 1 or 2 reports from prior randomized trials that someone on the proposed study team played a meaningful role in conducting. And then we review those reports to make sure the study was indeed well conducted. For example, that random assignment was carried out successfully and resulted in treatment and control groups that were highly similar, and that the study was able to collect outcome data for a high percentage of both the treatment and control groups. Now, this next point I really want to emphasize. We recognize and we prioritize the need to expand and diversify the pool of researchers with RCT experience. And so we want to strongly encourage researchers who are new to randomized trials, including those, and especially those from groups historically underrepresented in the research community, to participate in this funding opportunity. And so we want to be clear that individuals who don't yet meet this criterion themselves may still serve as a study's lead researcher, as long as they partner with a colleague who does meet the experienced researcher criterion and will play at least a key advisory role in the study. We really don't want this, this criterion to be a barrier to researchers who are newer to RCTs to participate. And so if you have questions about whether your study team qualifies, we welcome you reaching out to us for assistance in addressing the criterion, and maybe we can sort of think creatively to make something work. All right, so the third main criterion that we look at is whether the applicant team's proposed study design is valid. In other words, does it have a sufficiently large sample and other elements needed to generate credible evidence about the program's impact on one or more targeted outcomes of high policy importance? And we strongly encourage designs that measure such outcomes in both the short and longer term, so that we can determine whether the effects endure long enough to constitute meaningful improvements in people's lives. Now, the specific follow-up period for a study will obviously depend on the specifics of the study and sort of the questions that you're seeking to answer. And just to give you a sense of it, we've funded studies ranging from, on the short end, 1 year post-random assignment follow-up, all the way up to 14 years post-random assignment, with the typical study having a follow-up period in the 2 to 4 year range. And to give applicants a sense of what we look for when assessing the strength of a proposed study's design, our RFP links to a document that we prepared entitled Key Items to Get Right when Conducting Randomized Trials of Social Programs. And importantly, we look for relatively simple, what we like to call meat and potatoes analyses of an RCT. So we tend to look more towards ANCOVA analysis rather than more complex methods like difference in difference or growth curve modeling. And the reason for that is that at the end of the day, we want to be able to clearly and transparently convey the findings from the studies we fund to policymakers and practitioners. And we find that the findings from these more simple methods are typically just as rigorous as those from more complex methods. And they're just easier to convey and easier for policymakers and practitioners to wrap their heads around what the study did and what it found. So those are the main criteria that we look for when looking at letters of interest and full proposals. And Aaron's obviously going to get into some more specifics. But I want to just talk very briefly about our application process to give you a sense of that. And everything I'm going to talk about now is in the RFP, so you don't have to commit it to memory right now. But the bottom line is that we try to make the process as streamlined and as easy as possible, both for applicants and ourselves. So first of all, we accept applications on a rolling basis. There's no submission deadline. And we also make grants on a rolling basis throughout the year. For initial submissions, we ask that applicants provide just a 3-page letter of interest that primarily addresses the importance and experienced researcher criteria that I mentioned, and then provide just enough detail in the study design so that we have a general sense of the study's parameters. You know, what's the sample size that you think you'll be able to achieve? What outcomes are you going to be measuring, and over what follow-up period? We also ask that the letter of interest provide an indication of the overall funding amount being requested, which can be approximate. We don't need a full budget at the letter of interest stage. And then also at the letter of interest stage, you know, as I mentioned earlier, an applicant doesn't necessarily have to have all of the necessary partnerships in place, you know, for program implementation, data collection, random assignment, but there should be a clear path toward getting those commitments in place, because we would want to see sort of letters of commitment as part of a full proposal. Now, if our reviewers find that the letter of interest effectively addresses those criteria, then we request a 6-page full proposal in which we ask applicants to address any questions that our reviewers raised about the letter of interest and to flesh out the discussion of the study design. And we also ask at that stage for a detailed budget to be submitted along with a full proposal. And we try to make this whole review process an expedited one and commit to reviewing both the letter of interest and the full proposal within 1 month of receiving them. And once we've reviewed, the LOI or the full proposal, there's sometimes, you know, some back and forth with applicants to get clarification on aspects of the project. But the whole process from letter of interest to getting funding approval from our board can take as little as a few months, though the average is probably more in the 4 to 6 month range. I should also mention that for projects that are ultimately awarded funding, we require online registration of a pre-analysis plan that lays out the key elements of the study. And we also strongly encourage grantees to share their data to the extent feasible with the broader research community as part of our organization's commitment to advancing research transparency. So finally, before I turn things over to Aaron, I want to just put in a plug for one other RFP, which we've issued in partnership with our colleagues on the AV criminal justice team for funding randomized controlled trials specifically in criminal justice. We'll put a link to that RFP in the chat, and as you'll see, that RFP's criteria are virtually the same as those for the more general RFP that I've discussed today, but is focused specifically on criminal justice interventions. So with that, let me turn it over to Aaron, and I'll look forward to answering questions at the end.
Thanks so much, Dave. I'm just doing a quick sound check. So can you give me a thumbs up? Okay, ready. Thank you, and thanks everyone. Thanks so much for taking some time out to join. So as Dave mentioned, the goal for this section is to help you submit a successful proposal. So over time, about 20 to 30% of letters of interest we receive eventually lead to grant awards. And this is for a variety of reasons. You know, sometimes a project just isn't feasible. It's not possible to do a randomized controlled trial that meets the selection criterion that Dave discussed. But there are common pitfalls we see in applications, and I'm going to discuss some of those today. Really the main limiting factor for what we fund and what we're able to fund is the number of fundable projects that we get in the door. So really the goal is to ultimately grow this number from 20 to 30% to anywhere above that. So I'm going to kick things off by talking about implementation of the intervention being evaluated with an RCT. So one of the most common issues we encounter in letters of interest is when an applicant has identified promising prior evidence for an intervention. However, the specific intervention they want to evaluate has never actually been implemented anywhere and therefore hasn't established feasibility. So it's maybe, you know, more of an idea in someone's head or a little bit more abstract. We want to be confident that the proposed intervention can be implemented as intended and has all the initial implementation kinks worked out prior to conducting an RCT. This ensures that the intervention is ready for an RCT and it gives it ultimately better odds of success. What we're trying to avoid is a scenario in which, you know, you go through the trouble of doing an RCT, you find no effects and no results, and ultimately we don't know if it's because the intervention itself isn't effective or of implementation failure. So we don't want to be left, you know, sort of scratching our head thinking, well, what do these results really mean? Second, we want to ensure that the intervention you're implementing comports with the program you're invoking as prior evidence. So what do I mean by that? What I mean by this is that you want to be sure that the intervention implemented has the same key components as the intervention you're using as prior evidence. And so this requires, it's a bit of a judgment call, but we want the intervention to be very similar to, again, in key components to what it was when it was previously found to be effective before in literature. And again, we recognize that some modifications have to be made. It's unlikely to be an exact replication, and that's fine. But again, a lot of we're looking for the key ingredients to still be there in the replication. Okay, next slide. Okay, so next I am going to discuss our importance criterion a little bit more. So first, I will start out with discussing the prior evidence piece. So we ask that you identify one or two particular interventions that, like I just mentioned, are identical or very similar to the one being proposed, and provide an accurate citation or two for an RCT or a study of that intervention. We sometimes get letters of interest that will include 6, 12, 15 different references to different interventions, and it's not always clear whether or how they're relevant. So if you could please include the specific citation and then also discuss what the study found in the text of the LOI, that would be very helpful to reviewers. Next, we ask that just to be realistic, to set realistic expectations about what effect size is likely given the impacts found in particular studies. So for example, often we'd want to discount effect sizes from non-experimental studies. And we'd also want to account for the fact that replication RCTs often find smaller effects. Next, I will quickly talk about widespread use. So rather than just stating as fact that the intervention is popular or implemented widely, bring some data to bear on this. So for example, the number of users, the number of service providers that are using the model, the amount of money spent at the city, state, federal level, just basically making a case that this is being implemented widely and we don't ultimately know what the effects are. And then finally, I want to emphasize something that we often see, which is that when we talk about satisfying the importance criterion, we don't mean that we're looking to fill a gap in the literature or looking for evidence of just an important problem. Rather, we're looking for evidence that a particular intervention will address that problem. So there's really no shortage of problems to work on in this country. And as Dave mentioned previously, our mission is really focusing on identifying the subset of outstanding programs that have credible evidence of solving these problems. And so therefore, at the letter of interest stage, we're really looking for some signal that this particular intervention is worth testing further with an RCT. Okay, next slide. Okay, so now I'm going to talk about a couple of things to keep in mind when thinking through your study design. So first, let's talk about power. This is a common issue that we see. So the proposed RCT needs to be large enough to detect effects that we might reasonably expect to find based on prior evidence. And again, I talked about this, I touched on this in the previous slides, but again, it's really important to be realistic about expected effect size based on the quality of prior evidence. So, for example, if a previous RCT finds that a particular intervention increased college graduation rates by 25 percentage points, you should increase your sample size so that your replication study can detect a slightly smaller effect. Again, we look at it more as kind of an insurance policy on making sure that the study is well powered to detect a smaller effect, which is common, which is often the case when funding replication studies. Another point is that we do not fund small efficacy trials in lab settings. We're really looking to fund RCT of an intervention implemented in the real world. And as a general rule of thumb, we're usually talking about trials with sample sizes in the hundreds at least. But again, it really depends on the minimal detectable effect that we're looking for, what the effect sizes are often in the literature. It varies across different contexts and different different sectors, and also of course whether it's an individual random assignment or a cluster trial. So next, we look for simple, well-powered studies that measure meaningful life outcomes, not just proxy outcomes or intermediate outcomes. So for example, in higher education, we're ultimately interested in seeing if a program meaningfully increases degree receipt or longer-term earnings, rather than just whether it increased enrollment or college persistence. And so I want to caveat this by saying that, it's fine and in many cases necessary to measure these shorter term outcomes. In some cases, it's necessary to ensure sufficient program take-up or sufficient treatment contrast. But the ultimate primary outcome should be the main outcome that we're trying to affect with this program. Also, as Dave mentioned, most of our studies occur over multiple years. So to the extent that we can measure whether impacts endure beyond the program duration, then that would be beneficial. And just to emphasize that long-term follow-up is something that we care a lot about on our team and that we look for. So I just want to put another plug for long-term follow-up. On the third point, I want to quickly mention the importance of including a pure control group or a treatment as usual group in comparison to the treatment group. So we don't just want to know how two versions of a similar program compare to one another. We want to know if the program is an improvement over and above what participants are getting anyway. So again, that sort of gets at the treatment as usual part. And so lastly, we look for simple, clean designs that convincingly answer the primary research question. More complicated designs, so a 10-arm trial, 2x2 designs, step wedge designs, most of the time, these designs are not necessary to answer the key research questions that we're interested in. We do fund cluster RCTs and we do fund a few multi-arm trials. But again, as Dave was mentioning earlier, the goal here is really simplicity, a clean study design that could ideally be explained to a non-research person, to a policymaker who is interested in taking the results of the RCT and having it inform a particular intervention or program that they're interested in. And I'll talk about this a little bit more in a moment in my next slide when I talk about cost, but the same idea applies from a cost perspective. So we look for streamlined and efficient data collection. And the question that should be in the back of your head as you're thinking through your study cost is, what do you need to answer the key questions? Okay, next slide. Okay, so finally, a few points on study cost. So as I was just saying, data collection should be as streamlined and efficient as possible in order to credibly measure the primary outcomes. So we and our board have a preference to measure primary outcomes with administrative data when possible. That often tends to be cheaper and high quality, rather than fielding surveys which can suffer from high or differential attrition, recall bias, social desirability bias, and in many cases will drastically increase the budget. So for example, if you're proposing an RCT of a workforce development program and you want to measure earnings, we would have a general preference to measure earnings with state unemployment insurance data or census data or IRS data rather than fielding a survey and using self-reports. However, again, if there is a compelling reason for original data collection, we're open to that. And we understand that in certain subject areas, especially the administrative data may not be as high quality or have sufficient coverage. So for example, we're funding an RCT of a healthcare delivery intervention that is ultimately hoping to reduce healthcare utilization of chronically ill elderly adults. And so in this case, our primary outcome of interest is healthcare utilization, which we're measuring with administrative records with Medicare claims data. However, we really want to be careful and ensure that any reductions in healthcare utilization aren't coming at the expense of patient care and patient quality of life. So we're also funding a survey to measure patient satisfaction and quality of life. So that's a clear case when surveys are necessary to complement administrative data. And again, ultimately the question you should be asking is this component of data collection sufficiently critical to justify the added cost. That's the case you need to make. And it's helpful to keep, I think, that cost benefit trade-off in mind while developing your budget. And then my final point is that also something to keep in mind is that the study cost should be commensurate with its level of supporting evidence. So in other words, the size of the grant we're willing to award is determined on a sliding scale of how well the letter of interest and the proposal meets our criteria. So for example, we're more willing to provide larger grants to studies of interventions that may have particularly promising prior evidence. So for example, large effects were found in a previous high quality single site RCT, or of an intervention that's in very widespread use. Whereas if a study has, suggestive evidence from, for example, from a previous quasi experiment that maybe found smaller effects, maybe had some study flaws, we'd be less interested in funding a $1 million study that proposes, really intensive, costly data collection, multiple surveys, et cetera. So that concludes my portion. So I will turn it back over to Bronte, who can kick off our question and answer part.
Okay, hi everyone. Thanks, Dave and Aaron. So we're going to get started with some of the questions that we had submitted as you registered for the webinar. So our first question is going to be for Aaron. So Aaron, what steps or analysis should an organization undergo to ensure they are prepared for an RCT?
This is a great question. So I'm going to reiterate a couple of things that I just talked about, but I think they're particularly relevant here. So again, we're looking for programs that have been fielded either in widespread use or prior evidence of effectiveness. So I think the first step is just making sure that, you have an intervention that is currently in the field, maybe in a pilot, and a lot of those implementation startup kinks have been worked out. Another thing to keep in mind is that, to the extent that you have connections to researchers to do some initial scoping to see if an RCT is feasible, that's great, that's very helpful. So for example, is it, figuring out if it's even possible to use random assignment? Are there enough individuals who could be randomized? These are some important first order questions to be asking. But if you don't have any researchers in mind, or you don't have connections to researchers, we can help. I think ultimately, if there's one thing to take away, it's that if there's a good fundable project intervention that meets our criteria, a barrier, apply or reach out. We can potentially help with matchmaking if the program meets our criteria, and sort of try to move things along. And then one other thing that I want to mention is that often it makes sense to do some small scale research in advance of, a larger RCT. So if it's possible to do, a comparison group study, a small RCT, to get, a sense of whether there's a signal of promising effects that warrants further study via an RCT, then I think that that's also very helpful to do.
Okay, thanks, Aaron. Our next question is for Dave. So Dave, what have been the policy responses to your RCTs, and how you changed the direction of policy in any state?
Yeah, so that's a good question. And I think sort of the big picture answer, sort of stepping back and kind of where we are in the history of our funding. As we mentioned, a lot of our studies are multi-year projects. And so, many of them are still in the field. We're starting to get more and more studies wrapping up and having final results, and we're hoping to have, more of them affecting policy. But I think there are a couple good examples that we can, talk about. So for example, we funded a replication trial of Nevada's reemployment and eligibility assessment program, which is a program for unemployment insurance claimants designed to help them get back into the workforce quickly. And the program was found, in an original trial and then in our replication study, to substantially increase earnings for unemployment insurance claimants, while also saving the state money by getting them back into the workforce quickly. And so we've had, outreach from a number of different states interested in potentially, replicating Nevada's model. And so we're having discussions on that front. Another good example is we funded actually a study in water conservation in Fresno, California, where the city leadership was basically looking at a new approach to monitoring water usage during sort of summer months when water is really at a premium in Fresno. And that was, those results aren't public, so I can't give a lot of details, but I know that the findings of the study did, find some suggestive changes that the city should probably make to how they monitor water. And I know the researchers are working closely with the city to figure out how to best operationalize the findings from that study. And again, I think in future years, we're hoping to have more and more of these sort of concrete examples of our studies influencing policy, because that's the ultimate goal. We're not in this to just fund studies for the sake of funding studies. We want to, influence policy and ultimately, hopefully, improve people's lives.
Thanks, Dave. So our next question is for Aaron. So the question is, should dissemination activities be factored into the budget?
So we think that this is really important. We think dissemination is a key component of getting the results out there. And we will and have provided some support for dissemination activities, but it tends to be relatively modest. So for the PIs to attend a conference or two, obviously to put together the paper. It's a small percentage of the overall grant. But something else that I'll say is that when you become when you have a funded project with us and you become a grantee, we have a communications team that can help with dissemination and sort of lend their resources through the press contacts and social media, and help to get results sort of out into the mainstream as well.
Okay, thanks, Aaron. So our next question is for Dave. What is your advice for conducting RCTs with state agencies for funders and data?
Well, that's a big question. So, as I think probably many of you know, how willing states are to work on research or how experienced they are in working on research projects varies a lot. And then even within states, from agency to agency, there's a lot of, heterogeneity in terms of how willing they are to do studies or sort of they're savvy for that or sharing data. But I guess a couple just general tips. One, I guess if you're working with a state agency, especially looking to use some of the data that they have, to the extent that the study that you're pursuing is something that's of direct interest to them and could sort of help them answer a question that they've been wondering about, or something that will help them in their operations or improve the effectiveness of their programming, that's usually going to be helpful in getting buy-in from senior leadership that might be necessary to to do randomization or to get access to data. Also, I know a challenge oftentimes with working with states on research projects is getting access to administrative data. Obviously, there's important privacy concerns and security concerns that need to be kept in mind. But what we've found over the years is that researchers have figured out good ways to get access to administrative data to measure important outcomes and answer important questions, while also keeping data secure. And so there's a number of organizations around the country that I think can help sort of provide tips on how best to engage with states on this front. One of those is sorry, I have it open here. AISP, which is at the University of Pennsylvania. It's the Actionable Intelligence for Social Policy. Another group in Colorado, which is actually where I am, is the Linked Information Network of Colorado. Both of those organizations have sort of worked out a lot of strategies for getting access to data and sharing data in a secure way that allows researchers to answer the questions they're looking to answer. And I can pop links into the chat with those two organizations.
Thanks, Dave. Another quick question for Aaron. Aaron, how do you handle randomizing with individuals required to receive services? So for example, an entitlement program.
Sure. So this is tricky. I mean, typically you can't really test an entitlement program with an RCT because there's no control group. By definition, anyone who's eligible for the program can receive it. There are designs like a randomized encouragement design that look at take-up of services. But again, going back to sort of the main things we look for in our criteria is that, we want to look at ultimate outcomes of interest. So, what is the impact of the program, not just on take up, which, we know is kind of a first order question, but sort of further downstream, what's the effect of the intervention on, health or education, attainment or earnings? So I think the short answer to this is that, for entitlement programs, it is tricky, if not impossible, but I won't say that it's quite impossible. There could be an interesting design, but it's difficult.
Okay, thanks, Erin. Okay, so we have another question. Are there any requirements about archiving data or making data available to the public? If so, under what circumstances, if any, are there exceptions made to this policy?
Was that for Erin or me?
Sorry, for Dave.
Okay. Yeah, so basically the way we look at sort of data sharing and archiving is it's a very strong preference of ours. To the extent that it's possible, we want want that data to be out there to sort of contribute to research transparency and let have people be able to try to replicate the findings of the studies that we fund. We recognize that there are sometimes barriers that can't be overcome in terms of sharing data. But I guess our hope is that researchers will try to think creatively about how to do that. And we actually have some guidance up on our site in terms of how to think about doing this and how to sort of overcome some of those obstacles. One group that has looked a lot at this is a group, another great acronym, ICPSR, which I'll also put in the data at the university or in the chat. This is the University of Michigan. They're a good resource for figuring out sort of how to get over some of the data sharing challenges that often come up. So again, it's a strong preference, but also we're realistic and we recognize that sometimes it's not possible to share data.
So we have another question that this could be answered by Dave and Erin. We want to clarify, people want clarity in what primary areas and issue areas we are interested in funding, and also if Arnold Ventures has any geographic priorities, both for location and scope.
I will take a first cut at this one. So we are truly open to, we are agnostic as to what specific sector we work in, program areas, and we really don't have a geographic focus. So long as the program is being implemented within the US, we're open to it. So, and as Dave mentioned, it's not just, AV does have, a couple of key areas that we have programmatic teams that work in: criminal justice, higher education, public finance. And I think the interesting thing about our team is that we are able to fund within those areas as well as beyond. So, early child education, there's a number of foster care, there's a number of areas that fall outside of, I think, some of the specific vertical teams at the foundation, but that we would but that we're funding RCTs in.
Okay, we had another question. This can go to Dave. Can you say more about the range of prior evidence that you consider valid? Does this include evidence on the intervention implemented elsewhere?
Yeah, definitely. Really, yeah. So I guess there's a lot of different scenarios where we, have funded studies based on, different types of prior evidence. A lot of times it is, where a program's been evaluated in a different setting, different state or different city, or, sometimes, a lot of times the prior evidence will sometimes come from randomized controlled trials, previous randomized trials, but oftentimes it comes from, as Erin mentioned, quasi-experimental studies. So really, I mean, basically what we're looking for, we're not sort of doctrinaire in like what exactly the prior evidence has to come from. It's basically just how strong of a case does it make that if we were to do a new evaluation in the setting that's being proposed, how confident can we be that, this program's going to work, recognizing that, a lot of things don't work and it's not all of the studies we're going to fund are going to result in positive findings, but it's really just it is a little bit of a subjective judgment. We look at the prior evidence to say, okay, how compelling is this case that that if we do the RCT at the end of the day, we might find something that really works in a big way.
And I guess just to piggyback on that, because I was scrolling through the questions and I saw that someone asked a question that I think is relevant here. The prior evidence does not have to be, we're not just looking for studies that the proposed PI has conducted previously. And in fact, I would think for the majority of studies we fund, the prior evidence that that's been used was conducted by a separate research team. So there doesn't have to be any connection between the research team.
So our next question, do we only fund field experiments, or are experiments administered online, for example, behavioral or nudge interventions administered online, eligible?
I can take a first cut at this, and then Dave, if there's anything you want to add. So I would say that we mostly look to fund field experiments. I mean, I don't want to say categorically that we wouldn't fund a nudge study, but we have funded them in the past. Although, what a lot of the evidence shows is that the effect sizes when they're found tend to be very, very small. And so it's, again, it seems unlikely that a study that came in that was looking at, sort of a smaller online nudge, or looking at sort of the administration of, a questionnaire or something, that would meet our criteria, just because, it would require prior evidence that it sort of has a meaningful effect on the outcomes that we're interested in, or it would have to be, in widespread use. And again, the widespread use point is tricky because these, we look for sort of widespread use with significant taxpayer investment. And for a lot of nudges, sort of by definition, they tend to be relatively low cost. So Dave, I don't know if you have anything else you want to add to that.
Yeah, no, I think you hit on it. I think for nudge interventions, that's a case where I think the prior evidence case needs to be pretty tight in terms of that it's a study that's looking at that specific intervention before. It can't just be, we're drawing on the broader nudge literature that, sometimes when you change the whatever the salutation in a letter or the wording of a letter, that sometimes, it affects outcomes. Like what we would be looking for is like, is there specific evidence that the specific nudge that you're looking to test produced meaningful impacts? But we have funded some in the past where that was the case, where they had pretty direct evidence suggesting that the nudge that they're doing, had some promising evidence from prior studies. And then on the widespread use point, I think that's right. That I guess the only flip side of that would be is if there was maybe a nudge in widespread use where maybe there was a compelling worry that it might be harmful in some ways, then that might be a case that could be made for a nudge. But yeah, sort of what Aaron was saying, the flip side of widespread use, since nudges are by definition very inexpensive and tend to have sort of small effects, that'd probably be a hard case to make, that, we really need to find out if this letter is working, unless there's a reason to think that it might be doing some harm.
Okay, thanks, Aaron and Dave. So this question, let's have this go to Dave. So this is from a program practitioner implementer side. The implementers who are interested in working with research partners but are struggling to find research partners. They're wanting to connect with researchers. Do you have any tips or ideas on how these program implementers can better connect with researchers?
Yeah, it's a good question. I guess a couple things is, you can sort of do whatever area you're in, you could sort of do, I see in the chat, somebody's offering their help. You can sort of do a literature review. I don't know what policy area you're working in, but sort of see like what randomized, search for randomized trials that were done in your area and sort of find researchers that may have done studies in this space and reach out to them. We also, I believe it may have been in the send out for the webinar, we have a document online where we list all of the projects that we funded and list the names of the researchers. So those might be good people to first contact. And then also, if you're really dying to do a randomized control trial, you think there's a good reason that it might fit our criteria, feel free to reach out to us, and it may be that we have ideas about, a researcher that you could connect with. Another thing to keep in mind is there are a number of, quite a few evaluation firms out there that you might touch base with that do evaluations across different policy areas, MDRC, Mathematica, Apt Associates, Impact, and then some more specialized ones like Economic Mobility does a lot of work in sort of the higher ed and workforce space. But I guess those are some initial thoughts. But again, like if you're hitting dead ends, feel free to reach out, and we may have some ideas for you.
So our next question, I can send this to Aaron. So one challenge with education studies is that a lot of educational policies and practices are administered at the classroom rather than the student level. Do you have any preferences for study design to randomly apply experimental policies by classroom clusters, or to circumvent policy delivery at the classroom level?
Sure. So we do fund cluster trials. So if the intervention is being delivered at the classroom level, then depending on the number of classrooms and the number of schools that are implementing the intervention, you could randomly assign classrooms to receive the intervention or not, and then do pretty straightforward cluster design there. I hope that answers your question, but if it doesn't, feel free to clarify.
Okay, let's send this one to Dave. So do you fund research that uses an RCT already implemented by government entities in cooperation with researchers in the past, but where there are research costs for evaluations that are needed to evaluate downstream outcomes in the future? Or do you prefer new randomized interventions with researchers partnering with government practitioners where all work is in the future, including the research evaluation?
That's a good question. I'm glad somebody asked it, because we fund quite a few studies that in terms of funding longer term follow-up of a randomized trial that's already underway. So we definitely like to do that. I don't know that we would say we have a preference between building off of existing RCTs or launching new ones. It really is. It all depends on getting back to, I guess, the original point. We're trying to find things that improve outcomes in a meaningful way, particularly over the long term, ideally. So that's why we are often interested in funding longer term follow-up, and we recognize that some other funding streams, particularly government, don't always allow for long-term funding. So that's definitely a role that we are interested in playing. So that's something you can certainly apply through this RFP for funding for.
Okay, so I think we'll only have time for a few more questions, just probably maybe 2 more questions. So the program of interest is widespread, but each location is too small for a sufficiently powered study. How does the evidence-based policy team, how would we evaluate a multi-city study? And what would we look for to make a multi-city study successful?
Sorry, I'm assuming this is my turn. I'm trying to find the question. Sorry, do you mind repeating it, Bronte, or is it in the answered part?
Yes, it's in the answered. Sorry about that.
Okay, you move quick. Sorry, do you mind repeating it? I can't find it.
So this attendee says, our program of interest is widespread, but each location is probably too small for a sufficiently powered study in that location. Mm-hmm. How would our team evaluate a multi-city study, and what would we look for to make a multi-city study make it successful?
I see. Okay, so if you have an intervention that's in widespread use, let's say, and it's possible to do individual random assignment potentially, you could look at, you could just do, it could be fine to not have this, not do a multi-site trial and not have the study sufficiently powered at the city level. And instead you could just, look at the pooled effects and make sure that the study is powered to detect, effect across all of the sites. And then, hopefully it would probably be useful to maybe do some, you could do an exploratory analysis if you are interested in looking at sort of effects by site, depending on how reliable the impact estimates are. I don't know, if it's a small sample size, it might it might not be very accurate, but I think it's possible. Dave, do you have anything you want to add?
Yeah, I think you hit on it. We're definitely open to open and sort of like the idea of multi-site trials, because I mean that also gives you a little bit more of a sense of generalizability. That, you know, hopefully you do find, if you pool the sites together, you find an impact, and at least maybe the effects are hopefully in the same direction in both sites. That's definitely useful information to know. So I think that would be kind of a good strategy. Like if you don't have enough of a sample in a single site, if you can add another site, that's a good strategy to be able to get to a well-powered study. And, you know, we're certainly interested in that.
Okay, perfect. So Dave, how heterogeneous can the intervention to be tested be? Interventions are often defined generically, with protocol varying depending on the organization, the location, and the population. So I think this question's asking how homogeneous does the intervention need to be for us to include it in one study?
Yeah, this is a tricky one. Thanks, Bronte. So I think it's a good question. I mean, a lot of it is sort of a subjective judgment. We recognize that very rarely can you do sort of an exact replication of a program in a new place. That oftentimes, at least some tweaks have to be made to a new setting, or maybe a slightly new population. And basically what we're looking for is, we look at the sort of the prior evidence that's cited. What did the first study? What did that program look like? And then how similar is the program that's being proposed to be evaluated in the new study? And, it's a little bit of a judgment call that, ideally, if you've got an apple in the first study, you want another apple in the next study. But if it goes to a pear, we might be open to that. But if it's like a cheeseburger, and everything's changed, then I don't know. Then we're probably getting too far afield from the prior evidence. That was probably not a great answer to your question, but and I don't know. I guess I'm hungry.
I liked it.
A final clarifying question: does the evidence-based policy team fund pilot studies? Or do we like to wait and fund later stage studies?
Yeah, so I can take a first cut at this. So typically I would say we would be interested in a later stage study. And why do I say that? It's because, so as I mentioned, when we're looking at an LOI and trying to assess whether it's a good fit, one of the first things we look at is to say, hey, okay, has the intervention been fielded before? Has it been piloted before? So that's sort of a threshold question. I mean, I think, and we also, we want to make sure that that the study is well powered to detect an effect based on, the prior evidence. So, I think that it depends it depends sort of what you mean, how you define pilot. If this is really the first time an intervention has been evaluated via an RCT, then that would definitely be okay. But if you mean sort of a, small, sort of trying to give you sort of a preliminary sense of whether this, there's a signal there, that seems a little bit earlier stage than we typically go for.
Sorry, tech difficulty on my end. Thanks everyone for submitting questions, and we apologize if we did not get to your question. Know that we are writing down these questions and are going to try our best to write email answers to everyone who did not get their answers submitted. Additionally, if you have any other questions for us, you can contact us at these email addresses. If you're interested in applying to our RFP now, the RCT opportunity at Arnold Ventures inbox is where we accept our LOI applications. For questions about this RFP specifically, we're going to direct you to email Erin at ecrossett@arnoldventures.org. And if you have any questions about the EBP team and our work more broadly, feel free to contact me at bforsgren@arnoldventures.org. We do have a brief survey at the end that you can also submit any additional questions you have in a question box. And we also invite your feedback during that survey on this webinar and any way that we can improve and help you all through the grant process. So I'd like to thank you all for joining us today. Thank you for tuning in.
Thanks so much, everyone.
Thank you, everyone.
Bye.